5 मिनट बैठ जाइए वहाँ पर, है ना? I'll go there, पूरा लाइट आ रहा है चेहरे पे। मेरा फोन दे देना तो। Yes, Nana, it's okay. I'm starting now. Okay. गुड़िया 20 मिनट डिस्टर्ब नहीं करना, एक कॉन्फ्रेंस टाइप की चीज है। इसरा मैडम से उस रूम में जाके बात कर लेंगे। अभी बाहर बैठ जाइए। Good afternoon, everybody. My name is Dr. Punam Dixit, and today we are going to talk about what are the common problems related to pain during pregnancy, which can be very trivial and occasionally it can be serious. So in this discussion, we will be talking about the pain, which is a very common symptom and which really worries us. I work in a town called Patna, which is in the state of Bihar. My hospital is Punam Surgical and Maternity Hospital, and we provide broad range of services in area of maternity and gynecology. In maternity, we look after high-risk pregnancies, and we have an in-house ultrasound. So anybody who has certain problematic pregnancy, so we specialize in care of such women. We offer, which is related to this topic, that is painless labor, which you have heard, that is epidural. And so we go ahead with few lines about what are the conditions which can cause pain during pregnancy. Pregnancy itself changes the body in a very dramatic way. You are no longer yourself. Although we say that it is a physiological condition, but many of the circumstances change. As pregnancy advances, your energy level may not be same what it was. So to avoid any undue fatigue, you should take enough rest, because the same level of activity in a non-pregnant condition may cause you pain in the legs, may make you very tired, may give you a headache. So these are some of the common conditions, and now I'll deal with the trimester wise: first trimester, mid trimester, and last trimester. That is basically first 3 months, middle 3 months, and the last 3 months. In first 3 months, women often have pain in the lower abdomen. Mild discomfort is okay because your uterus is stretching to accommodate your baby. But any pain which is, and that applies to throughout your pregnancy, any pain which is more than mild, which is recurrent, and which is gradually increasing in frequency and severity is not a normal pain. So you should consult your doctor. Certain other conditions which are present during pregnancy may cause pain, such as women who have fibroids. Nowadays, many ladies, especially if they're working, they embark on pregnancy pretty late in their life. So they may have fibroids or ovarian cyst, and these conditions can again cause pain. So important thing to remember about pain is any pain which is making you feel unwell, for which you require a pain relief, and which is persistent despite taking a tablet of paracetamol, or you're vomiting, you're not able to sleep, you're not able to eat, is not a normal pain, and you should consult your doctor. So this is talking about first trimester. Another things which is common is a headache is very common. Somebody who never had a headache may start getting headache for the first time during pregnancy, and this happens because there is lot of accumulation of water in your body. And so for headache you should take any regular, any balm you use, do not use any diclofenac gel. You can use some oils which have eucalyptus oil, or if that does not relieve pain, it is okay to take paracetamol. Paracetamol is safe to take during pregnancy, but you should limit how many you are taking during a day. Do not take more than 3 tablets in a day, that is 500 milligram of paracetamol. Uh, and what else can cause pain during first 3 months of pregnancy? Say if you have urinary tract infection, constipation is again common, and that also gives a sort of dull ache, and that can be something like a colicky pain. But understanding your own body can sort of give you an insight. And for that pain, you needn't take anything. You just increase your intake of your roughage and water, and that should solve your problem. So this is a general introduction, and last, I would like to say a few pains which are really cause of concern for a doctor and for the patient as well. That is, if you get pain before 37 weeks of pregnancy, that may be a sign of preterm labor. And any pain which is, like a period like pain but more in intensity and coming at regular intervals, and gradually the interval is also shortening, so do not ignore that pain, because that can be a sign of preterm labor, what in medical language we call a threatened preterm labor. So do consult your doctor, because babies born before term, they are cause of concern, they require special care. And if you reach hospital on time, then that labor can be prevented, and we can give you medication so that even if baby is born before term, then the baby is sort of has less of breathing difficulties. So these are the pains you should be careful about. And other than that, one cause pain is very common. A lot of questions are coming up about the backache, and that happens because your ligaments are, your body is preparing for your baby to come out. So your ligaments relax to accommodate the head of the baby, and that gives a backache, especially if your posture is not very good, if you have a prolonged sitting. And that can be dealt with by taking paracetamol, or physiotherapy is a very good option. So do some exercises under supervision of a physiotherapist if you are getting persistent backache, or if you cannot access a physiotherapist, just walk, wear some fitting, good shoes, walking shoes, and walk. Walking is one exercise which does not harm the body, and you should continue doing it even during pregnancy, and is very, very helpful. So minimum half an hour of walking is quite good for your mind as well as for your body. Now we'll deal with the questions. भावना अनाथकत ने पूछा है, हेलो डॉक्टर, क्या पूरी प्रेगनेंसी में हल्का दर्द नॉर्मल है या डॉक्टर को आना चाहिए? थोड़ा बहुत दर्द जिसमें कि दवा लेने की भी ना जरूरत हो, ऐसा हो सकता है। और मैंने जैसा अभी बताया, आपने सुना होगा, जो वार्निंग सिग्नल्स है, जो पैरासीटामोल लेने से भी ना रुके, तो जरूर मिल लेना चाहिए। Second question is Revati Rajamani. Is calcium really needed to avoid joint ages? See, during pregnancy, you do need more calcium. So your baby's bones are stronger and your own bones are stronger. And that intake is quite a lot. Like 1 liter of milk has 1 gram of calcium, and that is excess we need during pregnancy. So if you're okay, if you doing with your diet, then you don't need to take calcium supplements. And joint ache, if transient joint ache, especially in hip joint, is common, but any persistent ache, as I have said, that use your common sense, and that is not normal. Okay. Uh, S- Sonam Patel, Sonam, I did deal with your question about the backache in my introductory part. So I think backache is very, very common. More than 30% of women would have backache. And paracetamol, massage, use of, like these regular balms we have that you can take, and physiotherapy you can, if it is really persistent and harassing, then you can take that. And sometimes if you're getting backache for the first time, especially in the second half of your pregnancy, that may herald onset of labor before time, so do not ignore that symptom. Rebecca Prakash, why do we get pain in pregnancy? See, the pain anytime in our life is related to so many factors. We have nerve endings in our, it is our nature's way of warning us, there are nerve endings everywhere in our skin, and that alerts our body, like when you're touching fire, you feel the burning sensation and you withdraw your finger. So physiology of pain is same whether you're pregnant or non-pregnant, and other types of pain which I just discussed in my talk. So that is the cause of pain during pregnancy. I think that answers your question, Rebecca. While I'm waiting for more questions, I would just talk about the labor pain is something. I think this was also a question, that is labor painful. See what happens, that labor does cause pain, and how well you cope. It depends on how well prepared you are, what sorts of support you have during labor. And certain types of labor are very painful when the baby is big, head is not well engaged, because the labor is all mechanics, like if the head is engaged and the labor is progressing normally, that labor is not very painful. And I have seen a lot of women who are pregnant for the first time have coped with minimum of help. Nowadays, many options are available when you have labor pain, and there is no need to worry about the pain itself. And like you can have certain medications which can be given in early stage of labor. Massage always helps. And if all this does not work, then you can have, like certain hospitals do have, a combination of nitrous oxide and oxygen which can be inhaled, or epidural labor, which is very popularly talked about as painless labor. It is not completely painless ever, but it does decrease about 80 to 90% of the pain perception you have during labor. And it's a pretty safe mode of analgesia, and anesthetist provides it. And when you have epidural, you need to tell your doctor beforehand that I do want epidural for my pain relief. And it is a very good thing to have, because labor can become very distressing, and we do sort of taper the dose during the second stage. And giving epidural does not mean that you will not have a normal delivery, but at the same time, it does not guarantee that you will have a normal delivery. So it's a very useful medical help which you can keep as an option. And wherever you are, you should discuss with your doctor before you go in labor, because the more prepared you are, the more comfortable your neighbor will be. And we all want to cherish, we don't have many children these days, and we want to make this event very memorable. And as a doctor, we are there to support you. So again, one type of pain which I did not discuss, certain uncommon conditions, like having a gallstone or having a renal stone, that can cause an onset of very severe pain with vomiting, and that is not very common, but then something we need to know. Appendicitis can happen during pregnancy as well, and that causes pain in the lower part of the abdomen on the right side, and it is associated with vomiting. And appendicitis during pregnancy, say, it does affect, say, about 2% of women. And if it is really appendicitis, then it can be removed surgically. So there are some conditions which are not related to pregnancy, and that can cause pain as well. So just waiting for more questions. I'll just talk about any more. Other thing about the backache is uh, we should not be wearing any heels. We should have a very proper posture. We tend to sit, like we don't keep our spine erect. Our spine is not meant for like slouching or hunching. It doesn't like. So there are several nerves coming out from the just from every vertebra. Nerves are coming out, and when we slouch or when we hunch, the nerves get compressed. So we need to sit properly. That is something very important, and we tend to ignore, and that can also cause backache or a discomfort in back. And people who do yogasan during who have been doing when they were not pregnant, there are certain exercises which are very helpful, and particularly the Pavan Muktasan series that I always advocate my patients, because even a beginner can do, but do not start any exercise without supervision for the first time in your pregnancy. That may cause. And something else I want to say about the posture. We have a tendency to, when we bend, so there is a way how you bend. You should not sort of just bend, like just roll over. First you flex your knees and then you pick up something when you drops. So these are some of the important precautions we have to take to avoid and to make our journey safer, happier, and something which we always remember. What analgesics are safe to take? I would like to stress on that. There is a very common analgesic, and a lot of patients, they eat it as if they have it in their purse, as if it's a toffee, and that is Combiflam, a combination of diclofenac and paracetamol. So do not take diclofenac during pregnancy. If at all, as I said earlier, and I would like to repeat and stress on it, that paracetamol is the only analgesic which is advisable. And besides paracetamol, your doctor can advise the others also, but leave it to them. If you have to take on your own, do not take any analgesic which is like brufen, diclofenac, sodium. Even as a gel, do not use diclofenac gel, because a reasonable amount of it can be mm, absorbed in your body. Nice tablet is something people do take, and it is still available, so do not take them. Pain is something which makes the whole family very worried. And what I have in so many, I've been practicing for many years now, 32 years. And as a doctor, I think it is my responsibility to offer maximum support. So once you understand, like what is causing it, then that itself helps. If you go about reading about the pain, then same injury causes different levels of pain in different people, because that depends on how your mind accepts it. All our signals which are carried out by the nerves in the different parts of the body, finally our brain is the processor, is the CPU. So how you perceive about it, so that is very important. And when I'm dealing with pain for our pregnant women, I always try to explain them that what is causing it. But not every pain can be explained. And in those situations, what we do is, is it serious? Is it going to harm your baby or yourself? No, then okay. Some amount of pain, sometimes, you may have to cope with it and continue throughout your pregnancy. Then again, the large group of pain is musculoskeletal, which is due to strain on our ligaments. And one pain which I would like to talk about again, because there's more time on it and there are no more questions. I'm just waiting for the questions. Just where your pubic bones unite in the lower part of your abdomen, there is a joint, and that joint again relaxes during pregnancy. That is a preparation for the baby's head to come down. And in small percentage of women, that can give very, like nagging and type of pain that can distress you, and we call it in medical language, because it happens because there is separation of that joint. Whatever type of posture which your physiotherapist or doctor will explain, that sort of relaxes the joint in your pubic bones, that is in the lower part of your abdomen, and that is a great help. So basically, the pains and aches during pregnancy, to sum it up, what I have talked so far, we we don't have to suffer. Do consult your doctor. Even the mildest of the pain can be relieved, and remember the warning signals, because what is dangerous, you should not sit at home. I, Sometimes I have had women who, they were about only say 7.5 months, and they had a pain, and they said, "Oh, I thought it was very normal," and they came say quite late when baby was sort of, we could not stop it. So these are the important signals that you should mm, draw a line, what is normal and what is not normal, and when in doubt, always consult. That never harms anybody. I'm still waiting for the questions. Talking of labor pain, as I said, the mind is the super controller. So the different people have different threshold. What I see in my practice, that the women from rural areas, they cope with labor pain very well, whereas people who have had a very sophisticated upbringing, they would, some of them, not all, they have sort of even very very early labor, and they just say, "Oh, this is beyond me, I cannot cope, and I want a cesarean." So there is no reason for you to have a cesarean just because you can't cope with labor pain. There is a question from Pinky, which is not related to pain, but the question is that when बेबी का सारा पार्ट कब तक कंप्लीट हो जाता है, बच्चे का जो विकास है एक बहुत ही अच्छी प्रक्रिया है, और विकास तो पूरी प्रेगनेंसी के दौरान चलता ही रहता है, लेकिन तीसरे महीने तक बॉडी के सारे पार्ट्स जो हैं पूरी तरह से बन जाते हैं. There's a question from Lakshmi Mishra. What pain should I worry about in early pregnancy? I did discuss in my talk, and I would repeat again that any pain which is persistent and which is coming on at regular intervals and gradually increasing in frequency, that is a worrisome pain, and it can be a sign of miscarriage. Again, another question from Lakshmi Mishra. What are the bad signs during pregnancy which I should not avoid? See, the warning signals during pregnancy are second half of pregnancy. If your baby is not moving as much as it was doing, that is very never normal. Any discharge of water or blood from your vagina, that is abnormal. a throbbing headache, like you're feeling very throbbing headache and you're feeling unwell, that can be rarely a sign of what we call a disease of increased blood pressure during pregnancy, and that you should always avoid. And that is called medically preeclampsia. It affects about 2% of women, and that you should not avoid. Despite every good care, there are certain complications in pregnancy which happen, and every patient should be aware and should avoid these problems. Can delivery be very painful? I have discussed this in my talk in great length. I think this talk will be available on YouTube also. I think labor and pain is a very, very old story, and there are many ways to relieve it. So, here I would just like to repeat, Lakshmi, that you needn't worry about the pain. It is painful, but there are a lot of things which can be done to decrease it. So I think that answers your question. And labor has got three stages. See, the first stage is called latent phase. When the neck of the womb, the cervix, dilates very slowly. So up to 3 centimeters is the latent phase, and that pain is not very, very severe in majority of the patients. I would say just multiply your normal period pains by 4, 5, 6, so that much. So, and then comes the active phase of labor when the cervix dilates from 3 centimeters to 10 centimeters. This part again is painful, and the final stage is quite distressing. And then the second stage of pain, when you push, that is the bearing down pain. So, these are the stages of labor, and at every stage, there is always a help, and there are methods to help you. So, do ask your treating doctor that how can this be made more comfortable. There is a question from Andrea. Is 12 weeks too late for first prenatal visit? Usually not. It is okay, you can. Amarjeet is asking a question. I think he's the husband. Mm, the expected date of delivery is 15th of July and there is no pain, so what should be done? 15th July is still time, and the expected mothers deliver about 7 days plus minus expected date of delivery, so it is okay to wait. But do consult your doctor. In certain situations, we do not allow going beyond the expected date of delivery. That would be 15th of July. Kavita Sahai is asking about backache. I think I did really dealt with it very detail in my introductory talk. Toothache, again, Kavita Sahini is asking. Toothache is not related to pregnancy itself, so you do consult your dentist. Uh, Toothache is not related to hormones. Shruti Maheshwari, when should I worry about abdominal pain during pregnancy? Any pain which is making you feel unwell, which is persistent, which is coming at regular intervals, that is a worrying pain and you should consult. Varsha and Rao is asking, my 20th week is going on. Whenever I walk or stand for long, I'm getting pain on the stomach, more like piercing pain, due to which I will not be able to sit, but the pain will not be there if I sleep or stretch. I think this pain is okay, but you should still see your doctor. Swati Singh, 23 वीक्स मैं 23 वीक्स प्रेग्नेंट हूँ. मुझे मॉर्निंग में यूरिन करते समय थोड़ा थोड़ा दर्द होता है. क्या डॉक्टर से दिखाना चाहिए? और नाभि के सीधे में एक यूरिन टेस्ट जरूर करा लेना चाहिए, क्योंकि यूरिनरी ट्रैक्ट इन्फेक्शन प्रेगनेंसी में ज़्यादा कॉमन होता है. यूरिन टेस्ट से पता चल जाएगा कि यूरिन इन्फेक्शन है कि नहीं. लाबू बवालिया, दुर्गा सालवी। हाय मैम, प्रेगनेंसी में बॉडी पेन हो तो क्या करना चाहिए? देखिए, बॉडी एक अगर थोड़ी देर के लिए है, थकान की वजह से है, तो आप एक पैरासीटामोल का टैबलेट ले सकती हैं, मसाज करवा सकती हैं। लेकिन बहुत बार बॉडी एक किसी फ्लू का या बुखार का भी शुरुआती लक्षण हो सकता है। इसलिए जस्ट वेट एंड वॉच करें, एक पैरासीटामोल लेके देखा जाए कि कैसा है। लाबू बवालिया, कि बच्चा नीचे के जैसा लगता है। आई थिंक दैट इज अ हियर से मेनी ऑफ द पेशेंट, बहुत सारे लोग पूछते हैं कि बच्चा किधर है, क्या है। तो प्रेगनेंसी में यूट्रस जो है एक छोटे से नाशपाती के शेप से लेकर के काफी बड़ा हो जाता है। तो उस यूट्रस के बढ़ने के कारण भी स्ट्रेच पेन होता है और पोजीशन कहीं भी हो सकता है। अभिजीत खंडेलवा इज आस्किंग, हाय मैम, HSG टेस्ट के बाद पेन कब तक रहेगा? 2-3 दिन रह सकता है, उससे ज्यादा नहीं। Samreen Qureshi is asking about the pain in the hip. So, to take some rest and take some paracetamol and apply a gel like which has no diclofenac in it. You know, the commonly available Amritanjan or any other gel is good enough. और द लेफ्ट साइडेड abdominal पेन जो है समरीन, वो कॉन्स्टिपेशन की वजह से भी हो सकता है, तो उसके ऊपर भी ध्यान देंगे। So it has been very good interacting with everybody and talking about a very common problem, that is pain during pregnancy. Myself, Dr. Punam Dixit, I would like to conclude here my session. I'm based in Patna. I'm I've done my master's and undergraduate studies from Patna Medical College. I'm a fellow of Royal College of Obstetrician and Gynecologist, London, and I practice in my own hospital. It is called Punam Surgical and Maternity Hospital, and we provide comprehensive range of services in the area of maternity and gynecology. I'm a laparoscopic surgeon, what is commonly known as keyhole surgery, and anything which is modern. I think I my special interest is, providing services which are patient friendly and one stop in this COVID time when the COVID-19 has worried everybody. We want to minimize the visits of the patient and offer them a very good solution, and they make minimum trips to the hospital. And most of the facilities which are available, we provide under one roof, like your OPD consultation, indoor services, operation theater, ultrasound, and laboratory. So, thank you very much. And it was a great pleasure interacting with everybody. Thank you very much.